and welcome to the Symptom Media Podcast, Bridging the Divide in Mental Health. I'm your host, Dr. Lindy van Niekerk, and I'm grateful you are joining us again as we continue our conversation on substance use among nurses. In part one of this episode, we heard the powerful stories of Kristin Waite-Labott and Dr. Lenzmeier, two nurses who navigated substance use, faced its consequences, and ultimately returned to their profession, not just as nurses, but as leaders and advocates for change. Today, in part two of our discussion, we shift our focus to solutions. Kristin and April help us tackle critical questions, such as what can be done to support nurses in recovery? How can healthcare institutions move beyond punishment to offer support? And what steps can colleagues, leadership, and the system as a whole take to break the cycle of fear and isolation? To explore Symptom Media's educational resources, visit symptommedia.com. Let's lean in. Kristin, I know you said you lost your job, your nursing license got suspended, and then as soon as you got back onto your feet, I read in your book that there was this moment where you realized you couldn't even work for any federally funded healthcare program where you just got a job. What was your experience with the nursing board and both losing your license as well as recovering it again?
Well, yeah, losing my license after, all of that happened was devastating. As I said before, nursing is the only thing I ever wanted to do. And I really thought that was gone forever. And so I was just going to go the rest of my life not being a nurse and really having no idea what I was going to do instead. I did end up getting a job at a doctor's office as a medical assistant and was going to a wonderful therapist. In 2007, so I lost all of that in 2004. In 2007, I had been sober for just over 2 years at that point. And my therapist asked me what I thought about calling the nursing board to see about getting my license back. And I just kind of laughed at her. I thought, they're not going to give me my license back. Are you crazy? Why would they do that? With all the stuff that I did, they wouldn't. And she was such a wonderful therapist. She said, well, do you know that? Have you asked them? And I said, well, no. I couldn't imagine calling the nursing board and saying, hi, this is Kristin. Would you give me my license? Like, I couldn't even fathom that. But she was just so encouraging and patient and kind. And she said, I think you maybe should do that. Maybe you could just call them. Like she suggested it, kind of like you said, April. It wasn't a you should or you will. It was a suggestion. Maybe you should. So after some encouragement, I did call the board, and they weren't interested in, shunning me from nursing forever. They just wanted to make sure that I was safe to practice. And so the nice lady on the phone said, yes, of course, you can join a monitoring program. And in Wisconsin, it's a 5-year, pretty intense program. And the Board of Nursing will monitor you as you're working to make sure that you are practicing safely. And so I applied to be in the program. I got into the program. And when I received that letter in the mail reinstating my nursing license, granted with a fair amount of limitations and restrictions, I was just overjoyed that I could be a nurse again. I can't even tell you how wonderful that was. The program was hard. And as you mentioned, about a year later, I found out that because of my drug felony, I could no longer work with any federally funded program. So no Medicare, no Medicaid, nothing, which is all hospitals and clinics, like it's the vast majority of healthcare. So I was out of work for a little while, but I did find a research company that didn't use any federal funds, and I got a job there as a nurse, and really have been nursing ever since. I graduated from that program. I have my full licensure back today. So pleased about that. Like I said, I really thought that part of my life was gone. So the fact that I get to do it, I feel like I get to do it. And it's I'm just very grateful for that. But it was hard. The program was hard. Right now, if you look at my nursing license, everything that I went through, and this has been now starting 20 years ago, everything that I went through is public record. So if you look at my nursing license, you can see everything. Everybody can. All you have to do is have, internet access. And that will be the case until the day I die. It will always be there. And I struggle with that a little bit. I'm not saying I don't want anyone to know, but I think it would be nice if after a period of time, I don't know what period of time, but, could we maybe say, yes, you are forgiven. We're going to remove this. It'll still be accessible to the Board of Nursing, of course, in case something comes up in the future, but could we remove that from public view? So that's maybe my biggest complaint about that. The other complaint I have is that there really isn't any support as nurses go through that program. At least there wasn't back when I did that, the program. There were about 300 other nurses in the program that I didn't know about. I thought I was like one of a few awful, terrible people who had done this terrible thing. But there were about 300 other nurses going through similar circumstances, but we had no way to connect with each other. In some of the work I do today, I learned that other states, like Minnesota, like New York, Colorado, have peer support programs or support for nurses as they go through those programs, which I think is really important. And so we started one with Marie Manthy's help and April and other folks in New York and Minnesota. We started WisPAN in Wisconsin Peer Lines for Nurses to be that support for nurses as they go through that program. We've expanded to other things now too, but nurses today have the support that I would have really liked back in the day. Like they have that now, and I think that's really important. But we are one of few states that have it, and I think that's something we need to work on, and we are actually working on that. But really important to support nurses as they're transitioning, because that is a huge, overwhelming time to lose your license and then be put in this monitoring program and then return to nursing, and you're supposed to do all that without support. Just seems a little bit counterproductive.
Yeah, I'm struck by what you said earlier. I think when we were speaking about who you are is more than just the job you do. April, you said you're more than just being a nurse, but I also hear, Kristin, you saying you're more than just what you went through, than your substance use problem. And it's hard if that's the thing that's front and center everywhere all the time. April, you've often said, or I think in your work you've wrote that addiction is not recognized as a disease, but as a moral failure dealt with by punishment. And in your opinion, how does that approach really hinder people coming forward, getting the help, those 300,000 nurses that Kristin mentioned? How's that stopping them maybe from getting the help and support they need?
Yeah, it's like I mentioned when I first opened up and shared my initial story, is I was just devastated to have this secret. And if my secret got out, my life and my license would be destroyed, and I wouldn't be able to be a nurse anymore or have a life that I'd worked so hard to have. Nurses don't just sign up to be a nurse. We work really hard for it, and we study very hard, and we have to hold a lot of information, a lot of skill, and a lot of knowledge behind that license of ours. And when it's threatened to be taken away because you are having this, what you think or what I thought was a moral failure, that's a pretty scary position to be in. It took me a very long time in my recovery to find out that this is actually not a moral failure, that this is actually a very complex disease process. And it does not define me. I'm April with a complex disease process, and it really, I think we're making headway in helping the public see this and helping the nursing profession see this. We are not there yet, but we're making strides. And an example I'd like to share is we have a global recovery community online called In the Rooms, and we're going to talk a little bit more about that a little later. But I am one of the conveners that convene these meetings every Tuesday. And we started with 3 nurses, and we have an average census on Tuesday evenings out now of 100 nurses around the world. That to me tells me we're cutting through shame and stigma. The more we show up and the more we talk about it, and the opportunity that we have today to talk with you about this is another approach at cutting through shame and stigma. Another example that I have where I feel like we have to talk a lot more about is in the curriculum in nursing schools right out of the bat. We've talked about that. We can talk a little bit more about that. But it's really in the workplace, wherever that is. If it's in the ICU where I worked the majority of my bedside nursing, or if it's in a clinic or where a long-term care facility, rehab, I don't care where it is. There has been a culture that I have seen where nurses are giving report to another nurse and making subjective comments and judgments about a patient that is being cared for with a substance use disorder. What are we saying about them as we give report and handoff? What is our attitude towards them? Are we being critical of them and judgmental of them? And are we handing it over like, oh, there's April again. I can't believe this drunk is in with another bout of withdrawal. And it's, just really negative and shameful things that nurses have said that I've heard and been a part of. Or are we showing up with compassion and understanding? And are we being supportive and creating a plan of care for these patients that is about support without the shame and the stigma? So we have so much opportunity to address this head on. And like I said, I think we're making progress, but we have a long way to go.
Thank you. Kristin, I want to fill in the gaps. I think because you shared about spending time in prison, then recovering your license, but what was that, what really supported you in recovering your life and your profession? If you want to tell us a little bit more about that, just so we have the full story.
Yeah, absolutely. Jail for me was the thing that took me out of my life for a little bit so my brain could clear. I didn't like it, and I don't advocate for sending nurses to jail. But if I want to look at the positive things, it did take me out of all of that, removed my access to alcohol and drugs for 4 months, just shy of that, a few days shy of 4 months, which allowed my mind to clear. Being in a miserable situation put perspective on where I was in my life and where I wanted to be. I knew that I did not want to be there ever again. I did not want to feel the way I felt towards the end of my using. As I sat in jail, those first few days in particular were just awful. I never wanted to be there again. When I was released from jail, I say I threw myself into recovery because that's what I did. I had some experience with 12-step meetings, as April mentioned. That's her thing too. I had some experience with that. I had tried it. So I knew that it was a place that I could go. So I went to meetings every day. I got myself a sponsor and I worked those steps as if my life depended on it, because my life depended on it, and the lives of my children and my family. Like, we all, struggled and were hurt by the stuff I went through, and just really committed to doing everything I could to be sober. I went to therapy, which I told you I had tried before, but I really was not engaged. I could not open up. Jail gave me that ability. Like, I was so open. Like, I just had decided I was done fighting. I wasn't going to fight anything. I was going to be completely honest to the best of my ability and go from there. And so when I met with my counselor, we talked, and we really talked. When I went to therapy groups, I told a whole group of people, which was completely foreign to me, how I was feeling. I cried in front of people, which was, I still don't like doing that, but it was completely foreign to me. So I did all of those things with my full heart, like every bit of me, and it made a difference. I began to feel stronger. I began to feel, as April said, I began to feel like I'm not shameful. I did some really crummy things, and I acknowledge that. I'm not suggesting that any of that was good. But I, aside from those things, am a person worthy of love and support and recovery. And so from that, really from that day of getting out of jail on, I did everything I could, everything people suggested. I stopped listening to myself and I listened to people I trusted, and continue to do that today. I still go to 12-step meetings and I go to my peer support meetings now. And it's the focus of my day-to-day is making sure that I'm okay. And so my whole focus is different and changed and better.
I feel like I'm almost hearing what you said in the beginning, as where you said caring and helping others is just part of who you are, but there was this switch that happened where you realized you are as worthy of that care and helping as well, and that gave you that desire to get the help, and believe that you're worth getting it, which I think is such a beautiful shift in that unique quality within you as well.
That's
April,
exactly right.
April, you've mentioned the role your mother had, the 12-step program that you joined, how the impact of other nurses speaking up has helped you. But you've also said a few times that you noticed you were spiritually empty and that you had to refill. And I think this journey of recovery is a physical, an emotional, and a spiritual one. And I'm wondering if you can say a little bit more about how that has helped you in your recovery journey.
Yeah, just like we're learning that there's an alternative to discipline for nurses, there's an alternative to shame. And learning that I'm April 1st and then a nurse next. I walked into a recovery program and they said, "Who are you?" And we had to go around in a circle and say who we were. How did we define who we were, and to share that in the group. And there I was, I am a nurse. That's what I said. And I was very, very, without even thinking about it, that's what I said in that group that day. That was a Friday. And when I went through this recovery for healthcare program, it was a weekend program. And when I came out on Sunday, I left April again. And that transition of finding out who I spiritually am and really how I am defining myself, and what would it look like in a world without a nursing license? What does that actually mean to me? Was really what I needed to figure out. And then I could start letting the promises and the miracles of recovery into my heart. And I've mentioned it before, but my primary group is Alcoholics Anonymous, but it's not a substitute for something. It can't be one or the other. For me, and what Kristin and I are finding in the work we do and in the literature that we know of, is it's that combination of a nursing peer support program with a recovery of choice that really helps you fill your spirit back up and get the resources and the knowledge that you need to keep going. And if any nurse hears this today, and if you're suffering alone, to just know that there is help out there in new ways that you might not think. I dedicated my project. I can give an example of some areas in healthcare organizations here in Minnesota that have stepped up their game through the employee assistance programs and a wellness page. On a wellness page, for one healthcare organization, it talked a lot about weight loss, and it talked a lot about smoking cessation, and an apple a day keeps the doctor away, and how you can exercise and eat better. And my project for my DNP, I was able to bring the links to that page for nurses that were working for that organization to get the help that they need if they had a substance use disorder. And just getting it on a website, just putting it in front of people, was a huge step to getting nurses that spiritual help that they need and that physical help that they need. And it's just, Marie Manthe used to call it laying the crumbs along the way for a suffering nurse to pick and see the path to recovery and spiritual wellness. And that's what Kristin and I are trying to do, is lay a pathway of crumbs for you so that you know that there is a better way to live and a better way for your spirit to thrive in this world.
And you both are definitely doing that as advocates. I mean, sharing your story here as testament of you speaking up for other nurses in doing that. Kristin, I know you've been very involved in your own hospitals as well, trying to make people aware of something very practical, which is just the exposure that they face daily to dangerous substances and putting those safeguards and protocols in place. Could you maybe share a little bit more about that?
Yeah, of course. Excuse me. So I think the first thing is education. I think nurses, but not only nurses, people that work with nurses, and nurses truly are not the only people that are exposed to dangerous substances at work, physicians, pharmacists, pharmacy techs. So really all folks whose job is to administer or prepare medications, controlled substances in particular, need education. Education on the substances, that they're dangerous, that they're at increased risk, that they need to make sure and follow protocols so that they and their colleagues can be safe, that the signs and symptoms, educating on how to recognize when a peer may be struggling. What does substance use look like in a peer? Like like April, a very high functioning, an excellent nurse, never had a bad review until I was diverting and was miserable at the end, had never had any issues at work. So what does it look like when a strong nurse is using, especially at work? What does that look like? And then what to do if it's suspected, if you have a peer that you're concerned about. What do you do? How do you, number one, get up the courage to say something? Who do you say something to? How do you do that? I think education on all of those things is really important. Yearly, not just a one time and okay, now we can move on, we've checked that box, but every year just updating people, like, this is just a reminder, this is an issue. I think it's really impactful to include a story of a person like April or like me that has gone through the experience. It makes it more real. It makes it memorable, other than just clicking through a PowerPoint of slides on statistics and policy. It makes it more memorable. And then I will tell you that my diversion began through that wasting procedure, or lack thereof, and it was allowed to continue for about 3 years because of that lax wasting procedure that we had at the hospital. Now, as I mentioned, everything was on paper back then, and now we have these fancy, a lot of us anyway, have fancy machines, so it certainly is better, but it is not an absolutely a process that prohibits diversion by any stretch of the imagination. We need to be very careful about adhering to the wasting procedures in our hospitals or clinics, wherever you are. I encourage friends, peers, coworkers to watch each other as they are wasting controlled substances, and not just to put their credentials in the machine and walk out of the room, leaving the nurse there with the extra medication as well as the dose for the patient. If you're familiar with that wasting procedure, typically what's supposed to happen is 2 staff will go to the machine that gives you the medication, will log into the machine, take the medication out, and then you will remove what medication you need for the patient, and then waste the remaining medication or dispose of it. At the place I work now, I work in an emergency department again, we have a solution that we squirt it into and it neutralizes it. And then the nurse that has witnessed it will go back to the machine and put their credentials in, acknowledging that they did watch the waste, and they will leave. Often what happens is that person that witnessed, without watching the nurse do the wasting procedure, will just put their credentials in and leave. Again, leaving that nurse with the full dose. It's just really dangerous. Like, that is where diversion happens in that moment. And so I encourage, the people I work with know my story. I'm very open about it. So they know that I will expect them to watch me waste when I ask them to do so, and that I will watch them. And I think that has really helped that process. So being very cognizant to follow that procedure, I think, is so important. It keeps us safe, but also our peers. You're doing it for them. You're doing it to keep them safe. Although it's a little uncomfortable to stare at somebody while they're doing their wasting procedure. Make small talk. How's the weather? It's terrible here in Wisconsin. Lots to talk about there. And then another thing I would point out is, we, in our ER, we use Dilaudid frequently. It's a pain medication, an opioid. And often our doctors, or not often, they always order 0.5 milligrams. Like that's their dose. And the only syringe we had available to us was 1 milligram. And we probably give Dilaudid a handful of times every shift. Like we're giving it all the time. So we were having to waste a 0.5 milligram every time we gave that medication. Even if we knew the patient was going to need the second half in half an hour or an hour, we still had to waste it because that's our procedure. So I said to my manager, I said, is there any chance of getting like a 0.5 milligram syringe? I know they make them. I looked it up online. She's like, oh, I don't know. Let me ask the pharmacist. So the pharmacist was like, well, yeah, sure, we can stock that. And within a week, we have the 0.5 milligram doses stocked in our Pyxis. All it took was me asking the question, which it didn't occur to me right away. It took me a long time to realize, why don't I find out about that? So we can do things like that too, as nurses that are responsible for those meds. We can, do that, those kind of things to make our work environment safer for us and our patients.
So many practical and useful things there. And like you say, some of them aren't even easy. It's just asking the question. April, I want to ask you about, you mentioned a little bit around how we can better prepare students before they enter the workplace. And I'm wondering if you have any other suggestions of how do we make future nurses aware of the risks, or even just teaching them how to share their emotions. What would you suggest for the next generation?
Oh my goodness. First of all, I want to say when I was a nursing student, I was drinking so heavily, but it wasn't as severe of a problem yet. I was younger, I was stronger, everybody was kind of partying. But I've said it before, there was nothing in my curriculum at school to teach me about the way I felt about what was going on or what I was doing as a behavior with substances, particularly alcohol, with my alcohol use disorder. There was really no information. We were just kind of in the wild, out there trying to raise ourselves, or raised by wolves in nursing school. And so what I ended up doing is dedicating, again, another part of my DNP project to reaching out to universities and to other nursing schools to talk more about what are you guys talking about in your curriculum when these new fresh nurses in the 2 and the 4-year programs are just new to the nursing profession. What are you talking about in your class time, and what is in your actual curriculum to teach these nurses the risks and the consequences to their own spirit and their own feelings, and then the public safety of those that they're caring for. And really there wasn't a lot. And so we've made a lot of strides to make that better. The University of Minnesota was one of the first schools that has introduced these concepts within their curriculum. And they have included some toolkits for other schools to adopt, where they're talking about topics such as identifying the signs and symptoms of spiritual bankruptcy, identifying signs and symptoms of potential abuse, like Kristin was doing and like I was doing with my drinking. What would it look like when a nurse behaves in a way that some of these problems are going on outside of the workplace? What does that present like once they get to work? And then understanding the severe stigma and shame that is surrounding all of the things that we're talking today, and what is out there for peer support and other protective mechanisms. The University of Minnesota also initiated a program called Prevention, Awareness, Addiction, and Recovery Reentry, where it's this toolkit, like I said, that can not only help the nursing students where they're at, but they can adopt this, and it gives them things that they can incorporate into their programs, such as educational materials, peer support information, and seeing each other as a person first, and then a nurse. I think a lot of times we get caught up in our education at work, We get caught up in our training. We get caught up in the hiring and orientation process where it's focused mainly on the skill that a nurse brings. And to see that nurse as a person first, and then the skill that they bring, and all the things that they need to be whole as a nurse, needs to start in school and then be carried in over into the hiring workplace where they're going to be working.
So you both mentioned the peer support programs that you're part of, or that you've started and initiated. And I think, April, to touch on what you've said, I'm sure that's also a way where nurses can start seeing each other for who they really are. And if it needs to start with us as health workers seeing each other for more than just what we can do. Can you both maybe tell us a little bit more about the Wisconsin Peer Alliance program and then the one you also mentioned, April, and how those programs have been effective and that kind of outcomes you've seen from people being part of those?
Well, in Wisconsin, our Wisconsin Peer Alliance for Nurses, or WisPAN for short, has two arms. The first is how we started, that peer support for substance use issues that nurses are going through. Peer support really being one nurse talking to another nurse, a nurse with lived experience or a nurse that's been through it, talking to someone who maybe is a little newer to the experience and sharing kind of how they got through it, and instilling hope and a little bit of guidance can make a huge difference. So we've been doing that now for over 3 years, and nurses tell us all the time. We have nurses, they come back week after week after week, even after they're done with their monitoring program, because they get so much out of participating. It gives them a sense of hope, and particularly in the beginning, when things are so overwhelming and scary and they don't know what's going to happen. All of a sudden they have a Zoom room, because they're all virtual, a Zoom room full of other nurses that have gone through the same thing. And you can almost see them relax through the course of that hour, where they come in tearful and panicked and, afraid and scared. And then they realize, okay, maybe I can get through this. It's just been so wonderful. But last year we thought, boy, wouldn't it be great if we could intervene for nurses before they get to this point, like before the substance use is such an issue. And so we launched our peer support, we call it for nurse mental wellness. So we also have peer support groups for any nurse that wants support, that wants to come and talk about the issues that are affecting them on a day-to-day basis. And that has been an absolutely incredible group. Just bringing, those nurses that are going through something together and talking with other nurses who have been through similar things. It just gives so much healing, and I think so important. So that piece of it, that peer support, or nurses supporting other nurses, I think is a huge piece that we can give to nurses to help prevent the issues to begin with, but then also to help them through the issues if they occur. But we also do education. So much like what April and I are doing here today, we at WisPAN are happy to present. I will share my story. I have other nurses who will do the same, as well as education on substance use disorder in nursing. Like, what does it look like? What do we do if we recognize it? All of those pieces, because I think education is just as important as supporting nurses. Like, they have to know what they need support from too. So those two pieces, support and education, I think are the most important.
April, in your program, can you share a bit about that and what's similar from what Kristin has said, and how you've been doing the room you called it, I think.
Yeah. Very similarly, Minnesota has a program just like Kristin was explaining for Wisconsin, where we do all the same things. So I won't repeat that. But what I want to say is, wherever you are in the world today listening, there is probably something going on in your area. You could reach out to Kristin and I, and we could connect you. The deeper into this work that Kristin and I get, we're finding more and more nurses that are in recovery and in need of this work, and we're giving seed support to other states in the country to get this type of work that Kristin just mentioned up and going in their own states and in their own communities. So if your community doesn't have one already, ask us, talk with us. We'll help try to figure out how to connect you to the right resources, because there are so many that we're just not talking about. So the Minnesota Nursing Peer Support Network is very similar, like I said, to Kristin's in Wisconsin, but intherooms.com is what I would like to mention tonight or today, as far as what I am doing in the evenings every Tuesday, 7 p.m. Central Time. All nurses are welcome from around the world, and we are getting together to talk about what's on our mind about nursing and recovery. It has been an incredible opportunity for nurses to show up as they are, or in a way that they don't. That they aren't showing face or showing their name. We don't recommend that you hide behind an avatar, but you can if that's where you're at on your journey. No one is exposed unless they want to be, and we're getting together and we're talking about all the things that we've talked about here today. It's an exciting opportunity that Kristin and I have found on In the Rooms, where you're welcome as you are, even if you're a nursing student, even if you are a retired nurse, even if you're still using, but you have the desire to not use and you want to be better, you're welcome there. And if you take this program of peer support and you take an opportunity for some of these meetings that we offer, in person, the Minnesota Nursing Peer Support Network has in-person, Zoom, or the online, and then intherooms.com, which I mentioned. If you take just something of that peer support approach and you combine that with, for me, it's AA, but there's NA, there is smart recovery, there's agnostic recovery. There are so many different ways to combine the peer support together, and with it, it's a powerful punch into recovery that we highly, highly recommend, as well as education, of course, and training, as well as resilience and stress management. And there's workplace wellness programs out there now. There's workplace prevention programs. There's employee assistance programs. And then I just have to mention all the nursing professional organizations. Like for me as a critical care nurse, there was AACN, the American Association of Critical Care Nurses. But when you're a recovering nurse, please know that there is the American Society of Addictions in Nursing. There is the International Society of Nurse Addictions at more of a global and world stage. The American Nurses Association has a link to some of the topics that we talked about today. So there's just so much. It's not just peer support. It's a combination of all the things. Pick a couple of them for your own personal self, and then just dive into that, and it will heal you and help you.
What both of you have shared around the support, peer support, we heard similar aspect being shared around the value of connection and having a community around us as health workers. When we recently did an episode with 2 physicians around burnout, and that was similarly the thing that really made a difference to them. And that feels like a culture shift we need to make in healthcare, where we can really come together and build that culture of connection, community, and support. That will alleviate, I think, many of the challenges we face. As we start drawing to a close, I'd like to give each of you the chance to offer some words of wisdom or guidance to others who may be in similar shoes. You've already shared so generously of your experience, your time, but if there's anything else you feel, maybe there was something that you would have helped you to hear when you were in your journey, I'd like to give you the chance to do that.
I just encourage people to break through that stigma and the fear and the shame and ask for help. I couldn't do that until it was, my way rock bottom. It doesn't have to be that way. Get help early. There are so many, as April just mentioned, there are so many different options for you out there. Please reach out. Please get some help and support, and feel free to reach out to either of us. We're all over on the web. You can Google our names and you'll find us. So connect and heal.
We are not hard to find. I want to say again, and you've heard me say it before, your behavior does not define you. I was not ever told that until I made it to the rooms of recovery. And if I could have maybe just heard that message on my journey to recovery, my journey to recovery maybe would not have had to look like almost 30 years. I don't know, but I hope that someone hears that today, that your behavior does not define you and that this is not a moral failure. Again, this is a complex medical condition and it involves both biological and environmental factors. As nurses, you understand what I mean by that. You are worthy of the help, like Kristin said, that's out there for you, but you are highly skilled. You are compassionate. You are a loving professional because you are a nurse. I know that because you are a nurse. You can be healthy and you can be whole again. And if you take our not advice, but our gentle suggestion to rediscover your strengths and your purpose and your ability through recovery, the promises are there and the resources are there. It just might not look and feel like they are, and they can come true in your life.
Well, I find that encouraging as well, and that the journey to health and healing and wholeness is for all of us. So as a final, to end us off maybe today, I want to read another piece of Kristin, of what you wrote in your book, which I just thought was so beautiful. You write, what she didn't understand is that it isn't what you have, what you accomplish that gives you peace. The peace has to come from within. It would be many painful years before she would learn that. She has always been looking for peace, but peace isn't something you look for. It's something that comes from you living the right way. And so for both of you, you've gone through this journeys, you've returned to your role as nurses, but you're also mothers and wives and partners. How has the sense of peace that you've discovered influenced both how you approach your personal life and your professional life?
Well, I continue to look for that peace. The difference is I find it now, most days anyway. I know I'm on the right path in my life, which gives me a great sense of peace. You know, I do the things I do during the day to help myself, to help others. It keeps me moving forward, wanting to do more. It gives me encouragement. I living the right way, doing those right things. The peace just comes, and it's beautiful. It really is beautiful.
They say, and I heard in AA and other recovery programs that I've been in, just join us. It's not a big deal. It'll just change your life. That's all. And that's what it did, is it changed my life and it transformed me. And my emotions were so big when I was a little girl, and throughout my journey of problem drinking and recovery, I've learned how to stabilize them. I've learned how to put them where they belong. And I have had clarity of mind in addition to the peace. I've had a whole new perspective on life. I'm wearing a whole new set of glasses, as they say. I have an opportunity now to be self-aware. I have an increased integrity and ethics when I provide care to others and myself that I did not have before. And my coping skills have strengthened to the point where nothing really can shake me. My mother just passed a couple of weeks ago, and my wounds and my mourning is open and fresh from that. But I'm able to face it with ground and a foundation of coping and of strength and promise. And had I been drinking when this all happened, and if I'm drinking when anything big in life happens, I don't have that peace and that clarity of mind and that emotional stability, and it's a much better way to live.
While listening to you both today, I kept getting this image of this beautiful painting, because your stories are, there's moments of pain, there's been challenges, but yet there's such redemption in what you've been sharing, and it just feels like you're busy painting the most amazing picture of your life. And I just thank you for the chance to take a glance at it. And I feel like as people listen to it, it will feel the same to them, that they'll get to see a work of art that's very much still unfolding. So thank you. You've been very generous, and we really appreciate it. Thank you, April. Thank you, Kristin.
Thank you.
Thank you.
Thank you for taking the time to join us for this discussion. To learn more about our guests and access the resources mentioned, please visit the Symptom Media Podcast page at symptommedia.com. We look forward to having you with us again for our next important conversation.